Mckenzie repeated lumbar extensions in line. This is a good exercise for a posterior derangement or a central disc prolapse in the lumbar spine. This type of problem can cause lower back and buttock pain. If the prolapse is severe, then the pain can also go down your legs. It comes from the Mckenzie assessment and treatment philosophy. Undertaking this exercise, you need to have been assessed by a physiotherapist who is Mckenzie trained, as doing this exercise for the wrong problem can make things worse. This exercise is all about post-exercise symptom relief, or what is known as centralization, which is when the symptoms move away from the periphery and closer to the midline of the lower back. If your symptoms increase more peripherally after performing this exercise, then you must immediately cease the exercise and consult your physiotherapist. Also, if you have any cauda equina symptoms, which include bladder and bowel incontinence, retention, urgency, and saddle area numbness, then this exercise isn't right for you and you need to see your physio or doctor as soon as possible. If you're unsure, then don't perform the exercise until you've seen your physio or a doctor. Lying on your front in a press-up position, place your hands under your shoulders. Use your arms to push up so that your lower back arches and your pelvis remains on the ground. Go as far as possible, then slowly lower back down. Perform 10 repetitions as far as you can on each repetition. It can bring on worse symptoms during, as long as afterwards the symptoms either lessen or centralize. The frequency that you should do depends on whether your symptoms are above the knee or below the knee. For above the knee, you should do 10 repetitions every 2 to 3 hours. For below the knee, you should do 10 repetitions every hour. Once your symptoms have disappeared for 3 days in a row, then you can wean the frequency down slowly each day until you stop the exercise. Once recovered, you need to reduce risk of reoccurrence, which you should speak to your physio about.